Thank you very much, Ray. And I'm going to introduce you the second participant, the second presenter about the living well with kidney disease. He is the Professor Kalantar. He is the president of the European Federation, the International Federation of Kidney Foundations. He is a member of the steering committee of the World Kidney Day, so he is able to explain to us why is the reason what he choose or they choose the slogan, the living well with kidney disease. He's a professor of medicine and public health at the University of California, Irvine School of Medicine, and he's triple board certified in internal medicine, pediatrics, and nephrology. So thank you very much, Cam, for your time, and good morning for you. And of course, the floor is yours, and we will have a discussion after you.
Thank you, Mr. Daniel Gallego. So I don't know if you see the slide. Do you see that? Excellent. So yes, it's such a great pleasure and honor to work with Daniel in Spain and in Europe, and also to acknowledge Professor Raymond Vanholder. He has been an important icon in nephrology, and I've been always learning from Dr. Vanholder all these years. Now, going back to World Kidney Day 2021, so as you see here, living well with kidney disease. And I would like to say hi to everybody from Southern California. We're in Los Angeles. In January, we had a major COVID coronavirus surge. It was like a war zone here. I was crying every day, not running out of dialysis machines, but now it improved since February, and I hope everywhere you are, please be safe, receive your vaccines, and let's continue, especially if you have kidney disease, you must have the highest priority to receive your vaccines. Now, International Federation of Kidney Foundations and World Kidney Alliance is one of the co-founders of the World Kidney Day, which was created in 2005. World Kidney Days this year is about living well with kidney disease. But what does this theme mean? Every year, World Kidney Day has a theme. I have highlighted here the themes of the World Kidney Days of the past 6 years, such as kidney disease in children, obesity, women's health, universal access, prevention, and living well with kidney disease. The reason is because we thought while one of our missions is prevention of kidney disease or things related to education, what about millions of people with kidney disease? And these are my patients. These are essentially people like yourself. I have like 60 dialysis patients. I see them every week, and I have to some of them, I have very close relationship. And after 20 years of practicing, I went to medical school in Germany. I also learned in Nuremberg. I practiced nephrology in Nuremberg, then went to New York and now California. And after 25 years, I've come to believe that for us doctors, there are things that we don't see. And I'm very happy we are in the new era of understanding what it means to live with kidney disease. It's something that is beyond telling our patients what's your dialysis numbers, what's your phosphorus, what's your hemoglobin. It's about quality of life. It's about how they live every day. So during my rounds, nowadays I ask them, how's your wife? How are your children doing? These questions for me have become actually more important than telling the patients your phosphorus is this or your albumin is that. And quality of life, as Dr. Vanholder says, is an important metric. That means, do I feel happy with what I'm doing? And do I know what my priorities and values and goals are? Otherwise, there is no reason to do dialysis or kidney transplantation. So to advance research, practice, and policies, there is an increasing recognition to identify patients' priorities. What is my patient's priorities? Not my priorities. It's not my job description to provide dialysis or kidney transplantation or CKD or slowing progression. I need to understand what my patient expects, and I need actually to help my patient to understand, right? As a doctor. Now, if you look at here, the kidney care chart, is a lot of we nephrologists, we learned that start patients early on dialysis, right? This was something that we learned for 20 years. Now we say that maybe later is better or never dialysis. This is essentially, these are different concepts, the concept of supportive care, of never dialysis, the concept of life-sustaining care, early dialysis. But our patients are beyond this. They need something. You need something called hope. And you have it already. Otherwise, you would not be sitting here listening to this. You would not be trying to find out your options. Hope is the feeling of trust. And without hope, you wouldn't again be listening to me. So you're listening to me, you're celebrating World Kidney Day. It's because of the feeling of expectation and desire for certain outcome to happen. And I'm quoting now Dr. Alison Tong's interviews with patients. I don't want to think about dying. I want to be able to live well, not just live, to live well with my disease. Could be another 10 years, 20 years, 30 years, 50 years, or 100 years. CKD lives with you and you control CKD. That's our goal. And to that end, we nephrologists and healthcare providers, we need to make sure that symptoms of our patients do not affect our patients. That means irrespective of type of kidney disease, we want a person with kidney disease to live well, maintain social functioning, protect the normalcy, and have control. So look at here, this is quite interesting that doctors, when they were asked, we nephrologists, we care more about, look at the bottom line, mortality, hospitalization, blood pressure drops, vascular access, whereas for patients, what is important? Ability to travel, dialysis free time. A lot of us going and pushing patients, you need 4 hours, 6 hours, 10 hours dialysis, daily dialysis. Yes, that's great, but what about patients' life? We need to understand post-dialysis fatigue, immunosuppressive medications for transplants that have so many side effects, and ability to work and to study. So therefore, this is essentially the highlight of World Kidney Day 2021, symptom management, very important. I mean, if a patient is still tired, in pain, cannot sleep, then it doesn't matter how great medication, immunosuppressive medication, dialysis therapy I provide. Strength-based approach, build resilience, increase awareness and knowledge, support, and then impact of life on work, travel, study, dialysis free time, dietary restriction, instead of telling what to not to eat, essentially there's nothing to eat, eat well. And then clinical strategies should be based on, for those who have CKD, not on dialysis or transplant, should be based on slowing progression, delaying dialysis, improving cardiovascular health, and even when they start dialysis, we should start dialysis gradually, maybe once a week, twice a week, instead of saying that I want the best dialysis 3 times a week, at least 4 to 5 hours a day. Let's just do it gradually, incremental dialysis, preservation of kidney function. My patients want to still make urine, even if they're on dialysis. Yes, palliative care is important for somebody after 20 years, 30 years, 50 years of dialysis, but more important is symptom management, highlighting symptom management. So therefore, I would like again to highlight here involvement in life situations. And this is our message to the World Health Organizations, to kidney, professional societies. Let's work with the governments with the concept of life participation. That means let's bring this to one of the metrics of all societies. So I think I went over some of these things. These are patients group. I don't want to think about dying from the disease. I want to be able to live well with my disease. And let me go over another set of slides, is the choice. We need our patients to have choices. We can't just say that either when patient needs dialysis, either you start dialysis or there is another one not to do dialysis and palliative medicine. We should give more than 2 choices, right? We should give to our patients things such as conservative management to live even longer, expanded use of palliative care, that is symptom management, gradual transition to dialysis, as I discussed, gradual stop of dialysis, and among others, for example, highlighting palliative use of symptom management. Palliative approach is not for a patient to die. That is a wrong concept. It's for a patient to have symptom management. The symptoms, pain, fatigue, pruritus, as Dr. Van Holder highlighted, nausea, vomiting, they should all be controlled well. Otherwise, patient cannot concentrate at work, cannot enjoy family members, and therefore, look at here, for example, an example, fatigue. 89 to up to 89% of patients after dialysis, they're tired. Sleep problems, pain, cramps on dialysis, pruritus, itchiness. And this is another very similar. I mean, all studies show the same thing. You can feeling tired, dry skin, trouble falling asleep, trouble sleeping, muscle cramps, constipation. And we nephrologists, we tend to just see the patient and make sure that the dialysis is done well, make sure that level of tacrolimus or Prograf is well, and then move on. And that is the one that we want with this year's message to change it. Look at here, dialyze to live, don't live to dialyze. This is from a patient group. It's called Renal Support Group. And I strongly hope that the keyword renal doesn't go away, because kidney is important, renal is important. In Spain, Italy, in so many countries, it's called renal. Even in California, as you can see, patients group is called Renal Support Group. And this patient, Lori, who started dialysis as a child, and now she's, I think, 50 plus years old, she has created this group. And then this is another example. Dialysis means life. This is a patient who, at the age of 72, I think, started dialysis, when most people said that you should consider no dialysis. And then up to the age of 79, she lived well. And she, I'm sorry, I said she, I'm sorry, that's the lady behind her. That's the another patient. But this gentleman, he started actually dialysis at the age of 72, similar to that lady. And they both, and she's still alive, and he passed away last year, but he created Dialysis Means Life. Dialysis means life because he showed to patients how to enjoy kidney transplant and dialysis. So if we want to, so let me see if I go to my summary. In conclusion, effective strategies to empower patients and their care partners. And I didn't have time to talk about care partners. Care partners are caregivers. Caregiver is a correct word. But a care partner is also involved. That means you're not paid to provide care. Your life is affected by the life and disease of your husband, of your wife, your father, your mother, your children, right? So you are not just a caregiver, you're a care partner. And we need to minimize burden of CKD on patients and care partners. We need to empower them to be in control. And we need to come up with strategies to reach that end. I mean, shifting towards strength-based approach, changing nephrology, and 2021 is the year to go to reach those goals. And whereas World Kidney Day continues to emphasize the importance of prevention of kidney disease, and it's very important for your family members and your friends, when you have kidney disease, we need to make sure that patients with kidney disease live well. For example, one of the things I noticed in January when Southern California was a war zone and I ran out of dialysis machines because the entire hospital became ICU. If a patient has COVID-19, I was defending them not to be considered as lowest priority because we're running out of beds. And to tell them that these patients are full of hope. Otherwise, they wouldn't have chosen dialysis or kidney transplantation. Living well with kidney disease includes patients and care partner empowerment, live participation, and effective symptom management so that patients can feel well and supported. So with that, I would like to acknowledge colleagues at University of California, Irvine. We do a lot of dietary interventions, International Federation of Kidney Foundations. And these are my Twitters, Facebook, and LinkedIn. Thank you very much.
Well, thank you very much for this inspiring and interesting presentation. It is quite clear that the kidney disease is a lifelong burden, and so we should tackle in holistically and look with 360 degrees and view, and this includes minimizing the burden of the disease, increasing participation in daily life, and improving mental health. So living well with kidney disease from the patient perspective means to have a fulfilling life despite the kidney health condition. So Raymond and Carl, what do you think? How can we improve this education, these choices, all that the things that you have shared with us?
If I can start answering, I think one of the problems is
actually just to expand on what Professor Van Holder has mentioned. It's important for not just the doctors, but the entire what we call healthcare providers to know about the goals. And it's connecting with the patient, of course, in a professional way, but in a way we understand beyond dialysis, kidney transplantation, or CKD clinic. Now, I've worked in Germany. I used to do a lot of moonlighting in dialysis units in Nuremberg, and then in New York and California. And I noticed it's everywhere is the same, believe it or not. That means there is a disconnect between us and what our patients believe in and expect. And not that it's always like that. When we round on dialysis patients as doctors, as nurses, we still do know and appreciate a lot of things, but we need to make it more systematically approachable and understandable. That means while inherently Dr. Van Holder is a good doctor and connects to patients, and I try to do the same, we need to be taught that these are priorities and we need to understand them in a systematic way so that we can teach younger doctors, nurses, everybody, right? So this is essential. I'm hoping that we reach some of these goals this year, 2021 and beyond.
Yeah, you are totally right. And of course, the core outcomes is quite clear. It's so different from the patient perspective for professionals. And we would like to go beyond the biomedical approach. So we are running out of time, but I have two questions and one comment. One comment is from Henrik that says that he is glad that here someone talk about something else, that blood works or the analysis to measure what is good dialysis. No, this is one comment, and I think it's fine and it's good that to remark that. And we have another question about the COVID-19 vaccine. It is safe for immune suppression for immune suppressive patients because we are in immune compromised. Please go ahead, Cam or Ray.
Well, I can tell you, since in the US we started vaccination already in December, and it's now we are 3 months into vaccinations. In December already, I got my first vaccines, and then in January, actually in February, not January, in February we started vaccinating all patients. In the 3 dialysis centers I go in, and our transplant center, 60 to 80% of patients are vaccinated. I can tell you the 2 vaccines that are currently available in Europe and US, that means Moderna and Pfizer, BioNTech, they are safe. They are not even live virus. Everybody should receive them. Of course, you may have reactions. And when I received my second vaccine, I was sick for 1.5 days. But those are not because you get a disease. It's because of reactions to what is injected to you. So it's not a live virus, and it's okay for all transplanted patients and all dialysis patients to receive. And not only it's okay, they should. So please find a way to give yourself the highest priority and receive the vaccinations, especially the two types that are available, and both of them are good. There's none of them is better than the others or worse than the others. And then in the future, as the other 2 or 3 are becoming available, some of them are based on live virus. As far as I was heard, they are also safe.
I just may add that one of the problems is that transplant patients and kidney patients are not included in clinical studies, and that's really a problem because then we are working in the dark as doctors. So that is also something we have to work upon change.
Okay, only one final remark about the one question. Angeles is asking about the increasing psychological support. What do you think to improve the mental health and emotional disorders, as you know very well, is affecting patients? What do you think, Ray?
I can only agree with that. I think it's very important, but it's not reimbursed in most, at least in the Belgian system, it is not reimbursed or sporadically reimbursed. So that's a real problem. So then you have to pay it as a unit yourself, and then the hospital makes a problem. I don't know how it's in the States, Sam. Can you explain? Do you have better experience over there?
Well, I think, we don't have actually, that's maybe we want to push for something that governments and states to bring reimbursement for that part. That means life participation. That means, let's say the government of Spain covers dialysis, government of Germany covers transplants, immunosuppressive medications. But what about support groups, right? And in some states, in Germany, there is some coverage. How we can make sure that these activities, let's say if you, for example, Daniel, you spend so much time, how could your organizations even receive reimbursement from the government of Spain? And you guys provide that similar to, so because I believe that at the end of the day, patients like Mr. Alan Henry Nelson highlighted, the one who lived 8 years with dialysis and showed that dialysis is hope, or kidney transplant should be offered to everybody. That lady behind her, they need to find time to do this, because these patients can tell you the story better than me and other doctors or nurses. So it has to be from patient to patient, and patients who are designated for this sort of education should receive support from the state and government.
Well, thank you very much for your valuable opinions and thoughts and ideas. And yeah, we are at the end of the first roundtable. So please feel free, Raymond and Carm, to remain in the webinar. I'm going to give the floor to Emily Petrides, who is the Vice President of the European Kidney Patients Federation. She's going to moderate the second roundtable with dear friends and colleagues of another kidney patients organizations, and also patients and transplant recipients. So they are going to give us the patient perspective of what does it mean living well with kidney disease. So please, Emily, I know, are you ready?
The only thing is that I don't have the camera.
Okay, but is